I'm Dr. Bohage. I'm at the hospital right now, on call, and I'm about to head back to the emergency department to complete my medical admissions. I'm a medical registrar. And in this video, I wish to do an introduction to my company. I have yet to register my company with the medical board um, of Papua New Guinea, which is a requirement, and I certainly will do so at the beginning of the next year, and I will also update that with you. But because of the very pressing need for what I'm doing, this company, I will make a start to see patients, especially during this festive period when the clinics are closed, the consultation clinics, I mean. Mhm. And also because there are people, I mean, people who will need these services very desperately. Um, we can prevent the next person in the city, Port Moresby, from getting or from succumbing to the complications of hypertension um, and high blood sugar, right? So basically, the diseases, hypertension and diabetes, cost patients through damaging their organs. Okay, so you might have them and not have symptoms, and that's because your organs are yet to um, reach a stage of dysfunction. Okay, get that very clear. I'm explaining in a nutshell. Excuse me. In a nutshell, how disease happens. Okay. Um, Diseases like infections, okay, are a bit easier to detect, to manage, and have a better outcome, simply because they have warning signals that come before organ damage, all right, or any injury to the vital organs or any organ in the body. So symptoms like fever, feeling unwell, um, nausea and vomiting, losing weight, those sort of symptoms are seen especially in infectious diseases and are part of the reason, usually they are the reason why um, it's easier to present earlier to get helped. Excuse me. And now in diseases like hypertension and diabetes, it's more difficult because these diseases do not cause any of the warning symptoms that you get with infections, which I've just mentioned. Okay, that's the problem. So you're basically without any pain, without any warning kind of feeling in your body that will get you, alert you, and be concerned about, even concerned about your health. You will remain in the most raw state, mostly, meaning you will not even be prepared for what you're about to what is unfortunately, um, people were most many people were not ready, were not prepared for whatever that they experienced. Okay? And it's the same for all of us. That's one. Now, unfortunately, the other thing is when you hear of such things, um, the one of the most terrible things that could ever happen to someone is to find out their status and go into a state of denial. Okay, it's like it's like another way of experiencing fear, living with fear. So first of all, if it's a significant um, thing to take note of and address, usually someone will go into um, a state of denial, and these two combined, okay, usually the remedy for early, um, we call them morbidity in such people. So you find people, you hear about people being so healthy looking and then suddenly collapsing, or even suddenly collapsing and dying, or suddenly collapsing with symptoms of a stroke. And later, that's what you hear about. Someone just had a stroke or a heart attack. Okay. So I therefore registered my company because I cannot continue to sit around and observe this. It's insane. It's just insanity basically. You cannot keep watching something that you can do something about, that's within your ability to do. And I've seen how patients have done so much better just with nothing but the correct education, and not just the correct education, but putting it into the correct um, vehicle. Vehicle, the medium that you use to put that education in is as important as the information itself. And empathy and taking your time with someone are the pillars of effective communication. So you don't leave leave someone feeling like they're hanging and without answered questions. So they can be confident, empowered, because when you have successful transfer of information happening, a person has to be empowered and not be left hanging. And that's disempowering. Disempowering will lead to feelings of fear, and it's not a very nice thing to experience, especially when you're fully functional. You're not compromised by any symptom. So I realize this great need of um, providing a service that is empathic, that can see eye to eye where a person stands, um, and be very considerate, um, to see a person where they are and be respectful of boundaries, but not compromising the important message that they require, information, education that they need. Right. So all of these things together in one package. The medical package is the initial check. Right. There's only it's a very it's life saving, I would say. So glad I have this. Came up with this idea because it is so important. It's crucial. It's crucial that a doctor of the face, I imagine yourself as a doctor. You have the face of the health system. You are the face of the health system. And for you to take your time with someone at that stage, okay, I will recommend every single doctor do this. Okay. Do this and let's bring down this and then I'm happy to share this information because the people need it. Okay. And for very, very, not for absolutely, like the 10 kina, because there's a reason behind the fees. The fee is, before I talk about it, the fees are initial review is 50 kina, then I will do your investigations, blood tests. I'm giving my time for that, so my own time. So for my own time, you pay 50 kina. I will connect you to the services that you need in terms of investigating. And then for review, yes, again, I will give my time. So 25 kina for the review of the results. And that's it. I will not see you again. I will not, but I will provide the support you need if you have questions. Okay, there are just way too many people. And also, I have to, because I'm responsible for the public patients, all right, who are already under our services with organ involvements, with symptoms, okay, for lifestyle diseases. Okay, we're responsible every day for such. Okay, it's when I have a bit of free time that I will schedule you to see you. And it's not a dying emergency that I should rush to you. So when I have time, I will schedule your appointment and start, and I will start, and I will, we're with the hospital, so I will it provides you that confidence in us that we really are genuinely concerned about your health. um what does that mean for us? It means we get the next this is one population, and this prevents with this intervention starts to bring down one at a time whoever is going to come in with an if it's going to be a myocardial infarction or a heart attack or a stroke, whatever it is. Okay, this is how we start. We're not going to just wait at the end of the line for you. It cannot be so. And I, for one, have already awaken up to that, and there is simply no way I can go back. All right, so that's it. A very long introduction, I guess. Yeah, but it's so important and it's meant for whoever that needs it. So if you don't, be still and if it really um if your instincts can't wait to attack me, maybe to describe how I look in this video. You know what? I'm here to say just go ahead because that's the promotion that's needed. All right, people. So I do early detection, early intervention. The company is called PNG Primary Care Doctors. Doctors, it's a generic name because um, whoever that wishes to join me can easily sign up with the company. And if you're serious enough to become a director with the company, those spots are open still. At the moment, it's just two people, just myself and my colleague, um, Dr. Dubaba. Okay, so we've mentioned it to the medical director, not director, the coordinator, that this is what we're gonna do, and we gave our reasons already. And I'm going to get to the stage of registering it with the medical board. Um, yep, that's about it. As soon as I get it registered with the medical board, I'll proudly show you our certificate of registration, and that should clear any doubts about us. Yeah. So again about the fees, I before I go, the 50 kina, the initial fee, okay, that's your consultation and whatever prescriptions that we start you on, okay, 25, 25, and the initial review for your tests. Why it why the fees come in? Because that's the only way you're gonna make me prioritize you. Okay, you're without symptoms. So in my job description, responsible for people who are sick. Okay, so you're not sick technically, right? So I will not instinctively plus, with knowledge. You don't need me as a doctor curatively. Okay, for my time, I will then have to use my and given the number of patients that we have, we usually hardly have time enough on our hands for early intervention, early detection, right? So this is good for you. It helps you to the fees as well are they help bring your attention in, because when you give a part of yourself some money, pay some fee, it's like, it gets you to think, okay, I'm spending money for some things, obviously. So apparently, it's important, right? What's there for me? So it brings your attention, brings your focus into you, and helps us as well. So it's a two-way thing. The system, the fees themselves, right? So there's no way we're gonna do away with these fees, um, and expect it to be successful and sustainable. And also, the important part is to get me. So the moment I know that I have your fees, I will make my time, like my lunch hour, um, and the things that are involved in sitting down and truly getting to know the person and tailoring the medical advice to your needs. Okay, those sort of things take a bit of us as well. Right, so that exchange is so important. Yeah, and that's why those visas are important for to sustain this thing, right? And it's good for you. It's healthy. It's if it's good for you and it's healthy, um, it's great for a lot of things like your job, your family, etc. All the benefits down the line. You gain confidence. You have the knowledge that maybe is still a learning gap for you. We can quickly bridge that gap, get that gap closed, so you're now confident about what's there in life, um, and um, what you're avoiding from then on in terms of early prevention, early intervention in prevention work. All right, so if you're interested, check out or send me a message, and I will start scheduling you. And like I say, people are coming into the emergency department by the day with high blood pressure related organ involvement. Okay, that's what it is. Once it touches your organs in a serious way, you come to the emergency department. So by then, it's either you're terribly affected that it's severe. So it takes so much to get you back. You might lose a function, lose your thinking, no more cognition. So, or it might be mild, but you still might not really understand the dangers you're really in, and keep denying, living in denial, basically, until the more severe forms happen. And by then, usually it's too late. Okay. And really, at this stage, there is when you're walking around happily eating, sleeping with no issues at all, this is the time to intervene so that you do not get to you know the later stages of disease, high blood pressure and diabetes. Thank you very much for your time. A top day ahead.